We will now go through placement of the 52 mg levonorgestrel intrauterine system, also known as Liletta. This device prevents pregnancy for up to 3 years. Please refer to the pre-insertion videos to review candidate selection, contraindications and risks of IUD use, informed consent and shared decision-making, pain control, and recommended patient education prior to preparing for and performing insertion. After speculum insertion, clean the cervix with antiseptic solution. If indicated, gonorrhea and chlamydia cultures can be collected at this time. Next, place a tenaculum or atraumatic fulcellum forceps on the anterior or posterior lip of the cervix to provide traction during IUD placement. The manufacturer recommends insertion when the length of the uterine cavity is 5.5 centimeters or greater, as determined by inserting a uterine sound until resistance is met at the fundus. A no-touch technique should be used throughout the entire insertion procedure, where no part of the inserter that will enter the uterine cavity comes into contact with any non-sterile surface. Open the package, maintaining the sterile field. Orient the IUD horizontally in the same plane as the handle by laying the IUD against the back of the sterile packaging. Next, use your thumb to put forward pressure on the blue slider labeled number 1 until it meets the curve of the handle and hold it there. Then pull back on the strings of the IUD using equal tension on both strings until a hard stop is felt. This action properly loads the IUD arms, pointing in an upward direction in the insertion tube. Pull the threads upward or downward to lock the threads of the IUD into the notch at the bottom of the handle and maintain this set position during placement. The IUD should be contained within the insertion tube, with the distal tips of the arms just outside of the tube forming a semicircle. It's important to hold the blue slider forward with your thumb throughout this process. Remember that the inserter is designed so that your thumb will be in contact with the slider for the entire procedure. Move the blue flange on the IUD inserter to the length of the cavity determined from sounding the uterus by laying the flat edge of the flange against an edge of the sterile package. If sounding was not performed prior to insertion, move the flange to the most distal measurement on the insertion tube. Non-sterile or sterile gloves may be used during the insertion, as long as a no-touch technique is used throughout. Continue to maintain forward pressure on the blue slider on the handle, and use the tenaculum for countertraction as you advance the inserter into the uterus until the upper edge of the flange is 1.5 to 2 centimeters from the external cervical os. Move the blue slider on the handle of the inserter downward with your thumb until resistance is met where it meets the green slider and a common thumb recess is made for both sliders, about 1/3 of the way down the handle, to release the IUD arms. Wait in this position for 10 seconds to allow the IUD arms to fully settle into their proper open position. Be sure to keep the IUD inserter steady in the orientation that allows the arms to be flat within the cavity to decrease the chance of embedment of the IUD in the myometrium or perforation into the abdominal cavity. After 10 seconds have passed, advance the inserter to the fundus of the uterus, up to the point where the flange meets the external cervical os, or where resistance is met in case the flange was inadvertently moved during insertion. This movement allows the arms of the IUD to be flush with the fundus. While holding the IUD in this fundal position, slide the blue and green sliders on the handle of the inserter together all the way down to the bottom of the handle until a click is heard to completely deploy the IUD from the insertion tube. Ensure that the strings have been completely unlocked from the notch in the handle of the inserter and remove the inserter entirely from the uterus. Be careful to ensure that the sliders are fully pulled down and the strings are not still in a locked position, because if they are, the IUD will be removed with the inserter. Cut the strings so that 2 to 3 centimeters are extending outside the external cervical os. Remove the tenaculum from the lip of the cervix and observe for bleeding. remove the speculum from the vagina. The patient can now move out of dorsal lithotomy position. Observe the patient in a seated position for a reasonable amount of time to avoid injury from potential vasovagal reactions. Ensure the patient is comfortable and provide a reminder of any post-insertion care that was discussed prior to the procedure. For more information, please visit these websites.